Alright, so we just watched the interprofessional communication interview and now we're going to talk about it. Okay guys, so after we watched that video, I would like to know what are your thoughts on the role of the PT in this situation?
You want to go first?
I'll let you take this one.
Okay. So I thought the PT did a great job for advocating for the patient. Originally, the plan was to release her, I believe, by the beginning of next week. And then the PT stepped up and noticed how the patient was not ready to be discharged and gave her reasons to why. She was dependent in transfers. She didn't believe that the parents weren't ready yet to assist at home, and really advocated for the patient and gave her argument as to why. The team members also agreed with her and decided to change the discharge date to 2 weeks later. So I thought that was a very crucial moment in that conversation.
The only thing I'd add is she was also adamant about the education for the patient as well as the parents.
Yes, she was very adamant about the parents being there. That was very important to have, especially if they are trying to discharge her home. I do agree with that.
Yeah, and just like based on that video and based on the RIPS model, and on the APTA article, what classification would you pose for the individual process?
So I would more so pose the moral judgment based off of the RIPS article, and that's based on the beneficence of the healthcare provider. They made sure to carry out the treatment that was best for the patient's interest.
I definitely agree with that one. They definitely made sure that the patient's best interest was in mind in terms of the parents being there, and the OT definitely advocated in terms of the patient being in the best situation possible as well.
Yeah, and I definitely agree with that, just because there was an ethical component with this conversation. The PT didn't have to bring up her concerns, but she decided to do what is best for the patient, and that's where that ethical concern came in, gave her reasons why, and it was just looking out for the best for the patient, like we should do for every patient.
Now I know we all overheard the OT talking about the parents and the situation that's going on outside of what is happening with their daughter. How would you further address the situation with the parents being in arguments?
I definitely think that would be a good spot for the social worker to come in. Social workers do deal a lot with that kind of stuff, especially when we're doing that discharge situation. I think potentially with the parents having that argument, like the OT was saying, they thought maybe they overheard oh, you're gonna take her home or you're gonna take her home, so it might not be a united household. This could be negatively impacting our patient. Were she be sent home, could be negatively impacting her now. And I think it's just important to make sure that she's going home to that stable environment, because her prognosis already, she's not doing too great with her transfers. The PT said that. So with this factor from the parents, is she going home? Is this a reason why she's not, with all that stress, all that anxiety she's feeling?
Yeah, I definitely agree. It doesn't help at all. The PT was even unaware of the two different households, and obviously she had concerns about the education, even with the parents. It seemed like the parents weren't around during the session, so they wouldn't even know how to assist the patient in this scenario, and it just prolonged the recovery process, and it's not helping by any means.
Even that, the psychologist on the team said that she didn't even get a chance to talk to the dad. She only talked to the patient and the mom.
Yeah.
So that's another thing. We don't know where the dad's head at. We know the mom was stressed. We know the daughter's not doing too well either. So I think that's definitely something.
Yeah, based on the environment, you definitely want to have that better packed together.
100%. And with that being said, we talked about the OT, we talked about the PT. What are your thoughts on the conversations between all the team members as a whole?
I thought they did a good job communicating to each other. According to some research I looked at, there were 10 principles that described good interdisciplinary teamwork, and I thought they met most of them. Some were including good communication. I thought they had good back and forth. They didn't argue with one another. The head of the case listened to what the other team members had to do and adjusted the discharge plan as needed based on everything they were receiving. The other principal was just respecting and understanding roles. I thought they did a good job of that, and they did a good job incorporating, mixing the skills of each person. Obviously, they each have different skills, and they kind of blended well together in treating the patient.
I think there could have been a little bit of a better communication transfer, as in they were interrupting each other quite a bit, but overall the outcome for the patient was put first, so I think it was good.
I agree. There was maybe a little bit of like overlap talking over where somebody like maybe thought of something in the moment and they just like kind of said it out. Overall though, I do think they were able to communicate well enough to come out to the outcome that was needed, but definitely a little bit of betterment could have been had.
And just to follow up from that, what would you think is one strategy or one technique or one thing they could have done to improve their communication?
I think definitely going into this, maybe they could have used a little bit more communication in general beforehand if they were noticing these things, so it wasn't all coming out in this one meeting about discharging them very soon. So I definitely think their communication in general between the practices probably should be better before you get down to the sit down meeting.
Yeah.
Whether it's notes, whether it's like seeing them in the hall and like bringing up your concerns. But overall, I think it was.
Yeah, they could also use that to build upon, to help keep each other in contact.
Yes.
And make sure that when they do sit down, like you said, they're not over rambunctious about it. So
Exactly.
Yeah, and just kind of build upon that. About the parents, they didn't know about it until they started talking about discharge. The PT didn't know about the two households. The OT brought up the argument outside. So I thought they could have talked about that. If they noticed some things, they could have talked that beforehand instead of talking right before they're about to discharge them.
Yeah.
But I thought they did a good job of like, they did bring it up, better than not bringing it up, and then they adjusted when needed, and then brought up some more concerns with the patients.
yeah,
I agree.
and they caught it, which is good.
I agree.
So based on the collaboration effort of the patient's treatment plan, how do you think it affected the patient overall?
Well, based on their collaboration, I think it did really well with having that conversation because the PT was able to bring up their concern with being discharged as soon as they were. So they were able to come to that conclusion that, hey, we do need 2 more weeks for this patient. I think that'll be good for them because safety wise, and then it also gives them time to, get that patient where she needs to be, as well as now that this other concern was brought up, now you have more time to address this other concern being the parents in this home situation.
Yeah, and then I totally agree with that. They did well as working in a team. They each discussed what they were doing for the patient and how it was benefiting the patient. And I thought it just all blended well, so not much to add there. I just agree with what you said.
Yeah, I think that the safety of the patient was put ahead of everything, and that's the most important thing.
100%.